So the key elements for our training program are really to make the best well-rounded infectious disease doctor that we can. We want people that are well-versed in common things as well as some of the rare presentations of disease to really make a well-rounded physician, someone who's comfortable with all different types of pathology, all the different facets of infectious disease, everything from infection prevention to stewardship to wound care, and then the intricacies of all the different infections that we manage.
Infectious disease is a dynamic field of medicine. It's always changing. There's constantly emerging and re-emerging diseases, the threat and development of antimicrobial resistance. We really need a workforce that's going to be able to meet these challenges. I think the biggest pillar of our program is education in clinical care. We want to ensure that our fellows are experts in the practice of infectious disease medicine.
The primary goal of the program is to provide a great comprehensive education for the fellows. Having been the first fellow to enroll and actually go through and graduate from the program, I could safely say that I'd feel comfortable being picked up from here in Greenville, South Carolina, and being plugged in anywhere across the country, and I think I'd do very well internationally as well.
So in the 2 years here, they get to see a little bit of everything.
You never really know, what your day may look like and what type of interesting patients or clinical challenges that you may face, dilemmas that you may face.
We see patients in the hospital setting, so people who are acutely ill, all the way from intensive care units, both surgical and medical, to regular floor patients, and then outpatients as well. We have HIV clinics, we have other specialty clinics, wound care, hepatitis C, so they get a little bit of all of that, both the acuity and some continuity, getting to build those relationships with patients, see them over time.
They're going to experience a very wide breadth of infectious disease practice. We want to give them exposure really across the spectrum of what infectious disease physicians do. So that includes a large amount of time doing infectious disease consultation in the hospital, an acute care setting. Also seeing referrals to our outpatient infectious disease general office and following patients with chronic infections in that setting.
The great thing about our department is we are a bigger department for a community hospital, but maybe on the smaller end for an academic side. So we get the opportunity to really work closely with our fellows, and our fellows get to spend time with us. We've got a nice family atmosphere. I think our fellows are very happy here. They feel very supported in that.
We put fellows as a top priority. So our didactic lectures, our teaching cases, our micro rounds, all the opportunities for research are especially focused on the benefit of the fellow. We want them to thrive, we want them to be successful. We want them to pursue their passion and be the doctor that they want to be. And to that end, I'm most proud of that because I do believe our faculty members have put in a lot of effort and thought into making sure that that's the case.
We really want to be able to mold the fellowship experience around what someone is interested in and what someone's passionate about, so that ultimately the goal is to be able to prepare someone for the career that they want and also be in a position where they are enjoying what they're doing day to day.
And I think that really sets us apart, that we have that support for fellows and that the fellows can come to any of us at any time and feel that they're getting the backup that they need.
We love what we do. We think it's a fantastic way to spend a career in medicine, and so we really want to invest in people who share that passion and are going to be on the forefront of meeting these challenges in their communities and across the world.
From the welcome party to the graduation events at the end of the 2 years, it's a great experience to be a part of this group.